Hello, everyone. This is Matthew Monfort here, and today we have the special guest, Lene Rich from Illinois, and she is a vaccine injury advocate, being vaccine injured herself. And so, welcome, Lene. Can you please tell us a bit
Thank
about
you, Matthew.
yourself? Yeah.
Thank you. I am pro-vaccine all my life. I believe science wouldn't fail me. I was a nurse for 40 years. In December of 2020, I was given a clear cardiac clearance for a cataract surgery the following year, and it was with angiogram, cardiolite stress test, echocardiogram, CT of the chest X-ray, and multiple 12-lead EKGs. And after the angiogram, my cardiologist stated that the angiogram did not show one thing. And she said, it's probably clearer than mine. And she's about 20 years younger than I am. And I received my first COVID vaccine
So what you did
January
there is
16th of 21.
what you did there is you just set the stage that your baseline. So what she's doing there, folks, for you that are listening, she is stating, she has worked as a nurse and director of nursing even, and she is sharing with you that her baseline was good. So if you listened to what she had to say, that's what she was saying. So now she's going to go on and tell you about getting particularly a COVID vaccine.
I received the first Pfizer COVID vaccine on January 16th, 2021. I did not have any effects after that. I then received my second Pfizer COVID vaccine February 18th of 21. I started to get shortness of breath and fatigue. I also had alopecia, which is where your hair falls out. Since I was then working in a position of director of nursing for a private home health company, we served high-tech special needs children. So I was frequently exposed to the COVID disease and was working 11 to 16-hour days trying to obtain personal protective equipment for my staff and to watch TV with anything from the CDC, WHO, the Illinois government, and to write new pandemic protocols for the company. I thought I had caught the COVID disease. I had 30 plus COVID tests. All of them were negative. I was 62 years old in 21. I was advised with chronic diseases and being 62 that I needed to get a COVID booster. I received the third and final vaccine on September 27th of 21. Within 10 days after the vaccine booster, I had a major heart attack. It was an anterior lateral heart attack. It was in my kitchen. I prayed to God during the heart attack that I would not die because I live alone and that they would find me because of my stench. And I also gave him praise. I have no idea how long that took. I have no idea how long I was in pain. I could not even focus. I couldn't move. So I just continued the prayer. And all of a sudden, the pain and radiation down my arms stopped. I didn't have any side effects after it. But all nurses know that there's a heart attack that follows a heart attack, frequently called the widowmaker, and it's a second and deadly heart attack. So I kept myself awake until about 2 a.m. When I finally fell asleep. I
And this is for those of you that are listening, once again, she had great health, great testing that was done. Just happened chance by God, that she had this. And she'll probably get into it more. She was also writing the protocol for her company. But here she has a heart attack. And of course, I'm very strong and Christian and not ashamed of my beliefs. And I say very strong. That's by God's grace. We don't rest or on our own strength necessarily, but we say strong. We lean strong on Jesus. And
yes, we do.
and here,
Um,
she's praying to God that that God would spare her life. So here she goes from being excellent health to having a heart attack.
in less than a year. I continued to work through the ever increasing shortness of breath. I was a normal nurse and would not go to the ER as COVID was in full swing here in Illinois at that time. I called my cardiologist and made an appointment to see her, telling her that I had a heart attack. The appointment was on October 28th of 21. She came into the exam room and she said, "What are you doing here?" I stated that I had a heart attack at home. She stated, "I gave you full cardiac clearance less than a year ago. It can't be a heart attack." I then requested a referral to a pulmonologist for the severe shortness of breath and exhaustion. She gave me the names of 2 pulmonologists in the local area. I called to schedule an appointment and was told it would be 8 months before I could see them, as they were working in the COVID ICU. I explained my issue and was told they had a new pulmonologist that could see me in 2 weeks. I took the appointment. The pulmonologist listened to my history. I had been on oxygen at 2 liters per minute for 15 years at night, after a sleep study had indicated that I had no apneas, but dropped oxygen saturation to the 80s during sleep. At the time, they said it was possibly mild COPD with a past history of smoking. He had me repeat twice the dates of the COVID vaccines. He did a walk test in the office that day. I failed. I was given oxygen and seated in a chair during the test. The test was less than halfway completed. He then ordered me to use 3 liters of oxygen at night, get a CAT scan of the chest, a chest x-ray, and have some pulmonary function testing done. He called me and told me that the oxygen saturation dropped about 5 times to 84 during the overnight pulse oximetry test, but because I was not on oxygen, that was okay. I then said I had called and they had told me that you said I could continue the 2 liters. He said, "Oh, and then you need to increase it to 3 liters at night." I asked about oxygen during the day as I was struggling to work, struggling to get to my car. Anytime I was walking or doing any kind of work, I was having POTS, which is postural orthostatic tachycardia syndrome, where I would stand up or walk and start to get real dizzy.
Lene,
Yes.
What, as a baseline for those that are listening, what is a normal oxygen saturation?
Normal for the average person is 95 to 100. They usually say 96, but 95 to 100 is a good sat. And 84 is considered not good. There were times during this process that I was left without oxygen and dropped to as low as 64.
And at what point will a medical professional get concerned that, you know, this is, I mean, what's a sign that you could be dying, a percentage?
When you get into the 70s and 60s, it's very severe.
Okay.
Very severe.
And that's where you were. Once again, your oxygen saturation just plummeted.
Yes. Mm-hmm. Yes. And it continued to after I had an accident in the hospital. He asked me when I requested the oxygen during the day to wait a couple of days till he got the results from the pulmonary function tests, and said that it was negative for COPD, but showed some mild restrictive disease, which is asthma. He asked me to make an appointment to see the cardiologist again, as he thought I could have heart failure. He stated he would speak to the cardiologist. He also recommended a right heart catheterization to determine if the heart problem was caused by the heart or by the pulmonary system. It can go either way. The pulmonary and the cardiac system can both cause heart failure. I went to see the cardiologist. She again said, "What are you doing here?" I stated that the pulmonologist said he would speak to her and that he thought I might have heart failure. She blew the gasket, jumped up, took me out with her, and then she called the doctor out at the COVID ICU. They talked for about 30 minutes. She told me to stay at the appointment desk. She went in her office to continue the conversation and came out with a prescription pad and wrote me a prescription without even looking at me, saying, "I'm going to give you Lasix 40 milligrams to see if that'll help your breathing." She said something very rude to me, and she also refused the right heart catheterization. The pulmonologist ordered 2 liters per minute of oxygen during the day and 3 liters per minute at night. On a subsequent appointment, the pulmonologist increased the oxygen to 4 liters per minute around the clock, which is considered high flow.
Lene, what is Lasix?
What is what?
Lasix.
Lasix is a water pill to remove the swelling and the edema that's caused by heart failure when you have like a congestive type of heart failure.
So this
It's
this
also called left-sided heart failure.
this cardiologist is rude to you, seemingly maybe in denial, and yet still prescribes you a heart failure medicine.
Right. And at that point, I knew it was heart failure. I just didn't know why. I didn't know what caused me to be in congestive heart failure.
And give us a timeline too. What I know at the beginning of your testimony, I have it written here, and you may have mentioned the specific date, but you got your first Pfizer vaccine in January of 21. So that's very early on when these things were rolling out. Of course, you are a frontline worker, so you guys were given, presumably, now I know this is Illinois, but presumably passed to the front of the line, and you stood up immense pressure. I know you told me that. Um, and I guess just a thought came to my mind. I mean, you had a loved one reach out to you and said that they were concerned with you getting it, but the amount of pressure on you with your job was so much. And then so why don't you speak to that a little bit, if you will?
Okay. My son had encouraged me at every point not to get a COVID shot, and and for the last booster, he called me several times prior to it, and he said, "Mom, this just isn't good." And because I was a nurse, I said to him, "Son, this is mandated in the state of Illinois that all healthcare workers are vaccinated, or they can't take care of patients. They lose their job. They could lose their license." And I said, "This is my life. This is what I've done for 40 years."
Yeah.
And so he kind of backed off. He now says, "I wish I would have never backed off." But anyway, things are as they are.
And then as well as that is, we had a conversation about information, because this is ultimately an information war. I mean, this ultimately boils down to
It's totally
informed consent. And so,
Yep.
Many people, they had the mainstream media, especially I would say, baby boomers and Gen X, you just have watched certain programming, whether it be Fox or CNN or MSNBC or CBS or ABC. And so they can't all be wrong. And so I know that you tell me your story about just your access to information or non-access to information, if you will.
Well, I about 8 or 9 years ago quit watching TV because I didn't think there was much fit to watch, and the news even was so negative. So I did not watch any TV during this time. My information was totally coming from the sources that my job said to follow, which is we follow the CDC, we follow the World Health Organization, we follow the governor of the state of Illinois. Protocols were never written in any place that had a pandemic, because we've never had one. And so you watched every bit of that information come across. That we even had it in printed form. I got directions also from the state of Illinois health department, the Department of Specialized Care for Children, because that's who we went through. That they're the payer for our private care special needs children. So they guided some of our stuff, and I actually was told by them that I had written and presented my protocol first of any company in the state of Illinois. That second of all, in the region that person covered, she had all the way down past the middle of the state, and she said mine was also the best. So I was very diligent to make sure I saw every time the governor spoke, and the infectious disease specialists in Chicago, and the CDC and the WHO. I was right on top of it. I had my phone on my desk, and I put it on a stand because I wanted to be able to turn it on and watch whenever those were coming on. So I also did a lot of research in my computer. I did have news channels and that on my computer. So while I was at work, I did that. I did do a lot of writing and a lot of phone calling at night and that kind of thing. So that's why the long hours. So.
Yes. And it's fair to say that you feel betrayed. I know we had a conversation beforehand. You feel betrayed by the agencies, the WHO, the CDC, the FDA, the gold standards of health in America. Yeah.
The hardest thing for me to accept with my injury, first of all, I didn't know until September of 2000, or excuse me, 2023, that there was anybody else that was even injured. I thought I was the only person who got an injury from this vaccine.
Yeah,
And
that it's rare and it's just a few
rare,
people
yep.
and
And
yeah.
a lot of us, we thought it was rare till we found certain groups on Facebook that are for injured,
Yeah.
vaccine injured
And it's
people.
worth it. You know, it's worth it if, you know,
It's
if it's
so worth
rare.
it.
Yeah.
So when I thought it was rare, I was just doing everything I thought I could do with my nursing knowledge to check the issues that I had, not realizing the scope of problems that I had that were caused by the vaccine, which I have another list made
Yeah,
out that I'll
go ahead
read
and
through.
take us up to that point. Yeah.
Okay. After the pulmonologist ordered the 4 liters per minute around the clock, I did do my saturations and occasionally had complaints of air hunger and shortness of breath. So we finally got it all the way up to 4, and he said, if needed, 5.
Now,
Because
can
the
you give the
diagnosis
audience,
and
hey, Lene, can you give the audience who's not familiar with oxygen just kind of a quick idea of what a lot of oxygen is, or you know, what would be
sure.
used for a common, if you will,
Well,
comparison?
anybody at home is normally on 2 or 3 liters per minute. When you get above 5, it's very hard to keep you other than in bed because that's such a high level that it has to be a very direct source. Most of the portable oxygen concentrators, once you hit 5, that you're done. You can't do it anymore.
Okay.
So I still use tanks. I found the portable units to be very unreliable. So I carry tanks with me, and I can get extra time because they have now come out with this. Didn't exist when I was working with tanks in the hospital, but they have come out with what they call a conserving device. Okay, because the diagnosis and correct amount of oxygen took over a year. I went to from February 21st when I started the shortness of breath to February of 23 before I was put on 4 liters. So I requested a brain scan. The brain scan showed microvascular ischemia of the brain, which leads to dementia and is a permanent condition. I later had a CAT scan of the brain done, showing deep white matter changes after a mistake in the hospital had left me without oxygen for 3.5 hours. And this was due to a nursing shortage. The nurse had worked prior on a different floor and was working another 12-hour shift on the surgical unit where I'd had surgery. I have permanent brain damage. I'm losing memory and was finally referred to a neurologist with an appointment in February. I was fired from my job on April 17th, 2022, because I brought too many oxygen tanks, and then I got a stationary oxygen concentrator for the office, and then my tubing was everywhere. So that was his complaints. I currently have about $30,000 in medical debt. I also have about $17,000 of loans that I took from friends and family to pay my mortgage, or not my mortgage, my rent and my bills until I was finally put on Social Security in December of 22, which was early, so I lost some of my Social Security.
And how did your situation at your job go?
It did not go well. He actually laughed and he said, "It's ironic, huh? You're for the vaccine and you get heart failure." And so he came up with something to fire me for. However, I won in unemployment court twice. He appealed twice.
Hmm.
So let's see. I also have had 1 knee replaced, 2 hips replaced, 2 titanium discs put in my neck, and had a cervical fusion. The neurosurgeon in Chicago stated that I was now 64 and had the back of a 99-year-old woman. The COVID vaccine had accelerated my severe arthritis. I was also referred to a rheumatologist. I currently have 16 specialists on my case. I still have no one that's totally admitted that I have a vaccine injury. My pulmonologist and cardiologist were called by me after hours. I asked them both one question: is this due to the COVID vaccine? The cardiologist said, I told you your heart's fine, and hung up the phone. The pulmonologist stopped for 2 minutes or better and then said, highly possible. I said, thank you very much. And we hung up. I have had numb toes.
That was after months of wondering.
Yes, that was December of 21, December 31st of 21. I've had numb toes and fingertips for 3 years, and I have weakness in all 4 extremities that is documented. I have fallen twice with a cane and walker. I currently have 49 hours per month of caregiver services. And I also have an hour that pays for my Life Alert button that works in your home for about 400 square feet. In February of 2023, during the cardiac clearance for my upcoming neck spine surgery, the neurosurgeon required a cardiac diagnosis. And finally, after 5 cardiologists, I finally got my right heart catheterization that showed the heart failure was due to heart failure and not pulmonary caused. I have tried conservative medical treatments and alternative medicine treatments. They the complaint was from the cardiologist for all that time that it was pulmonary. The pulmonologist, of course, said it was cardiac. So this proved without a doubt which system was causing the heart failure. And then the cardiologists changed their story to, well, it's because you're overweight, Lene. It's because you don't exercise. I said, whoa, wait a minute. I said, not only have I lost weight since I was a director of nursing, but at the time I left my office, I was averaging 10 to 20,000 steps a day. So I said, this is not exercise or obesity related. I said, I had a perfect heart in December of 2020. And by September of 21, I have a massive heart attack and heart failure. The pulmonologist changed my diagnosis about sometime early 2022 from heart failure to respiratory failure with chronic hypoxemia, which is lack of oxygen to the body. And I couldn't figure out why. I thought, this is the only person who's been somewhat honest with me. Why would he change my diagnosis? Well, in May of that year, he was removed from the practice that he was in because of his honesty to me. I have many other symptoms of COVID vaccine injury. I wrote a list while I was waiting, and it's pretty long, but I'm going to read it. Alopecia or hair loss, edema or swelling, mottling to my toes when standing, which means they turn kind of purplish. I have vein engorgement. I have severe dry eye and mouth disease. I have chronic fatigue syndrome. I have the postural orthostatic tachycardia syndrome, which we refer to as POTS. I have dizziness. I have head pressure. I have electricity type pain to my left thigh at the base of my prosthesis. I have autoimmune markers that show the anion gap is low, which is suggestive of multiple myeloma and extremely rare. I've had E. coli bladder infections. I've had low oximeters. I've had muscle wasting. We all suffer from insomnia. Most of us have visual issues and puffy eyes. I know I am dying, and it will be ugly, as I already have some memory loss and some executive function loss. I started my career as a neonatal nurse practitioner and neonatal nurse transporter. I'm a ventilator nurse expert and a pediatric nurse. I was in nursing management for 25 of the 40 years I was a nurse. I am now fully disabled by the United States government. The prior COVID vaccine lies will be exposed. Please, if you haven't, read Turtles All the Way Down, Vaccine Science and Myth. It shocked me to my core. Our children are being vaccinated with poisons.
Yeah, absolutely. And I so appreciate all that you have said, and um, it leaves you speechless just to hear from you firsthand. And you're not alone. I know you. So what have you found out? I know that you mentioned a book. What have you found out since then? I know that you were saying that it was another book that you had written, etc. So you want to talk a little bit about what else you've discovered?
Yeah. I read The Real Anthony Fauci. Prior to that, my son was sending me podcasts after my injury. The first podcast he sent to me was Robert Malone, the inventor of the mRNA technology, who had spoken out on the Joe Rogan show about, which is a podcast about the danger of using those as COVID vaccines. He then sent me one by Aseem Malhotra, who is another doctor. He's a cardiologist. He was in his fellowship in, I believe, New Jersey. It might have been New York, on the East Coast anyway. And he was seeing correlation between heart disease and serious problems in cardiac procedures. That's what he was doing in his fellowship, was the procedures. And he was seeing a correlation to the worsening symptoms and everything to the COVID vaccine. So he spoke out about it. They told him at that time he may not get his license if he kept talking. He kept talking, and he did receive his license. He is now a licensed MD. He then later lost his father to COVID vaccine injury and hospital protocol. Then my son sent me Robert F. Kennedy Jr.'s Joe Rogan podcast. And on that podcast, I thought, this man is really, really sharp. This man uses words I have to look up. And so I bought his book, The Real Anthony Fauci, and I started reading it. And I couldn't read at first about 9 or 10 pages, and I'd have to stop and either scream or cry or whatever. It was so on point that it was amazing. And so I continued to read that book past the COVID section into the HIV section. And I'd had the fortunate position early in my career of working at a huge homeless indigent clinic. It was a free clinic at the time. And we housed the 19 counties around its HIV program. I was in charge of all the doctors in the medical department. And all the nurses and CAs and CMAs and health unit coordinators, nurse practitioners, PAs, everybody. We had 19 sites, and my chief of the HIV program came down to me and he said, I can't do this anymore. I said, what's wrong? What can't you do anymore? And he said, I can't give AZT anymore. And I said, why not? And he said, it's killing my patients. He said, they have so many sores in their mouth and they can't even eat. He says, they're dying of malnutrition. And I said, what do you suggest? And he said to me, well, a lot of the ones that use marijuana that's not legal, they're getting better. I said, well, what do you suggest to give them? He said, well, I suggest to tell them to smoke some marijuana, and I will give medical necessity prescriptions to them. And he said, but I also think they need zinc, vitamin C, antibiotics, things for urinary tract infections if needed. And he said, just basic comfort things. He said, let's get them to eat and be healthy. And so that's what he did. That's what he instituted. So as soon as I read the part about AZT and the problems with that started by Anthony Fauci way back when, I was just like, oh my gosh, this isn't the first time that he's done something like this. Not only is it not the first time, but he followed the exact prescription. You can actually read in the book, and he wrote down the steps that he would go through, including silencing the media at the time. Mm-hmm. And I knew all this to be true, so it was like so eye-opening. So I had a friend who has 2 autistic children from childhood immunizations, and she asked me to go to the Children's Health Defense meeting locally with her. And so I did. I went on a Saturday, and as soon as I walked in, the lady in charge asked me who I was and why I was there. And so I kind of told my story in a shortened version. And she said, wait. She said, I'd like to videotape you. So she did. At that time, I didn't know half of what I know now. uh, many of the symptoms I have, I attributed to aging or other issues that I've had in my life, other chronic illnesses. And I'm learning that no, they're actually from the vaccines. And so I'm learning more and more every day. And like I said, I didn't know there was any other besides me until September of last year. So in a short time, I'm learning a lot. I also have ordered and will be reading shortly Turtles All the Way Down. I got it from the library. I'm still reading the library copy, but I did order myself one. And it literally shocked me when I read that every single one of the current childhood injections was not properly tested. There was no blind or double blind or even just a randomly controlled trial on any of those vaccines that we've been giving children since the 1940s, 50s, somewhere in there. And that the vaccine and Big Pharma, the vaccine producers and Big Pharma had total immunity since the 80s. I'm like, this is unbelievable. Unbelievable. So I'm just getting into that book. I'm only about 99 or 100 pages in, but I'm continuing to read and research. There's another book I have ordered, Vax, Unvax, also by Robert F. Kennedy.
Yeah, I've read that one. Yeah.
I have since joined his campaign in Illinois.
That's right, you did. And I wouldn't agree with him on social issues, but if he's gonna put an end to the COVID mandate or COVID vaccines, I think that that's admirable because not even President Trump has offered to do that. So
nobody's offered it. He came out and just stated it. His book, The Real Anthony Fauci, was copyrighted in 2021. So while I was still believing everything was science-based and everything, he knew. He had the research articles delivered to his house. Over 584 research articles.
Yeah.
Amazing.
Yeah, I know that Vivek Ramaswamy, he did offer to remove the liability shield from the vaccine manufacturers as well. But yeah, Robert Kennedy, he's the white knight for this issue.
Yes, he is. He has definitely exposed it and took the risk of exposing it early.
Yeah. And so, Lene, I appreciate you sharing your story. I hope it reaches many people. For those of you listening, we do have SB 100 and SB 101, which deal with education and vaccines or medical procedures. And we also have another bill that's going to be in the House that deals directly with COVID. So stay tuned for how those are going and then how to be involved. So, Lene, in closing, is there anything else you'd like people to know before we close?
No, just that I will never shut up till I have my last breath.
Absolutely.
I'll talk about the vaccine injured forever.
Absolutely. And I believe the Lord will use you. It already is using you. So thank you for
Matthew.
Yeah, thank you for gracing us with your story. You did well. And we'll catch everyone next time. Thank you.
Thank you. Bye.